Welcome to the use of cupping therapy to address releasing the frozen shoulder. For clients who come in with a stiff shoulder or tension around the shoulder with a forward head posture, protracted shoulder, difficulty elevating their arms overhead, you can use the myofascial cupping tools to help increase fascial mobility around the shoulder to increase stretch and then hopefully functional mobility as well. So we'll take a look at the use of the cups. I invite you to look at my video on YouTube of the cupping therapy at the Exercise Resources. So look at Exercise Resources on YouTube and you'll find that. Now, using the cups, choose a cup size that fits the area that you're going to be working on. So here we'll be looking at the shoulder girdle. For someone with a finer body type, you're probably going to use a smaller cup. And with these silicone cups, I have the patient pre-lubricated. I've massaged through her entire shoulder girdle complex with coconut oil, which gives you a superior glide when working with gliding cups for fascial release. I'm choosing a rounded rim cup so that I have nice glide. I've also lubricated the edge of the cup. And these smaller cups have a more gentle suction than the larger cups, or the even larger rim cups here, to get a more deep suction effect. Remember that using the cupping therapy is a negative pressure, as opposed to the typical positive pressure of pushing into the tissue. The cups are going to be a negative pressure of pulling out. So if, say she had some shoulder stiffness and you had some difficulty with skin gliding around the shoulder, I could mobilize the soft tissue around the shoulder, starting with a very gentle massage to increase the circulation using the gliding cups. Patient's in neutral. She has her head on a little bit of a neck roll. It's for a neutral cervical lordosis. And just start to open up, and you can see there's some nice circulation response around the shoulder as I go. And this is a very gentle suction cupping massage. Make sure you get into that opening up the front of the shoulder, because that anterior axillary fold is usually the most common area of restriction and tension. You'll often feel some of the tight bands coming right across that anterior axillary fold. And the skin in many patients, especially if they've had chronic tension in their shoulder, the skin will even be tight. How does that feel to you? How is that?
Good.
Is there any discomfort at all?
No, not at all.
You like a nice massage?
Yeah, it feels good.
So healthy shoulders will feel like you're doing a massage. For someone who's very stiff, and especially if the skin is very adherent over the front of the shoulder, which you can do some skin rolling to see if it's adherent. And on our model here it's not, but in patients you'll often find that the gliding and the rolling is very difficult to accomplish here, and that's where you want to break out the cups so you can have a better grip. Also, pre-lubricating the tissue ahead of using the cups makes it easier for you to get a purchase on the cup, otherwise they tend to get very slippery. And I'll follow individual muscles, so I'm working the deltoid first, as you may have noticed, going arch into insertion. You can see the nice pink effect that we're getting from increasing circulation because it's bringing blood flow to the surface. When you go over a drier area or a bony prominence, the cup tends to slip off. So simply compress, place again, and automatically get that nice vacuum effect. And don't stay on any one area for much longer, only enough time to get that little erythema response, get that circulation. So it's an excellent warm-up before you're doing your deeper myofascial work, joint mobilization, or whatever is necessary or indicated across the stiff shoulder. Working around anterior deltoid into the pecs. Now, depending upon the person you have, when you're working with females, I'll keep a nice drape over the breast tissue, but I do want to go over the upper chest because of that pec tension. So being non-invasive to the ladies, having a nice drape. Also, where the platysma muscle comes in above to the skin, you can start working in the supraclavicular area. You just have to move the clothing out of the way. Make sure that you have that oil there for that lubrication. You could follow up the sternocleidomastoid, often tense when they have that forward head posture. Make sure you don't put heavy pressure over the carotid sinus, because you can lower their blood pressure, of course. It's a baroreceptor. So carotid sinus, you can feel where the pulse is, so you're going to stay away from the pulse. Going to be like posterior and just over the sternocleidomastoid. I could work in the upper traps, get into the scalenes, as well. So very nice way to start opening up the circulation around the shoulder. And the smaller cups are very, very nice for this area. Now upper trap, you might want to get a bigger cup or a little bit more of a grippy cup. So I'm using a larger silicone cup. Silicone cups are also greatly beneficial because they're so flexible and pliable. Find that trigger point in the upper traps, and you can start to open up that area as well. So instead of leaving them on a hot pack for 15-20 minutes, waiting to get them warmed up before you work on their shoulder, you could do like even 3 to 5 minutes, not even that long, of the cupping therapy, and you get a nice massage effect, a nice myofascial mobilization effect using the cups. You can also increase mobility of the shoulder using the cups from a static position, and we'll be showing that in our next video.